Senate Finance Committee will get back to sorting through hundreds of proposed amendments to a health care reform bill on Tuesday. The contentious issue of a government-run health care option will be at the top of that list. Is a public option still alive? Well, Republican Congressman Tiahrt from Kansas is a member of the House Appropriations Committee, and he's joining us live from Wichita. Congressman, thanks for your time today.
Shannon, it's great to be with you and your viewers.
Well, tell us about what you expect on the House side. We know what's been bubbling in the Senate. How are things coming together in the House where the public option has been so contentious and at times has split the Democratic Party in two?
Well, just this past week, the Speaker of the House, Nancy Pelosi, said that she is going to pass some health care legislation with a public option in it. They do have 256 votes in the House, and even though 40 blue dog Democrats or conservative Democrats have said they won't vote for a public option, they have been voting to get it out of committee. So I think she has enough horsepower inside the House of Representatives to pass a public option, even though the public doesn't want it.
How important do you think it is to show some type of bipartisan effort? Because we've heard it from the top down from the president himself that they want bipartisan ideas on the table and to get something done that the American people can see both sides of the aisle have supported. It sounds like we're heading down a path where that's not going to be a reality.
Well, Republicans have an option to this health care plan. It's called H.R. 3400, and it's a much more comprehensive plan that improves the current system rather than having the government take over health care. But in each and every instance where we've tried to have, either through the amendment process or additional hearings, the Republicans have been completely shut out. Every one of the amendments in the House have failed by a party line vote, even though they are good ideas that address the cost centers, that retain the ability of patients to choose their physician and physicians to choose the type of treatment that they should have. But yet we've been shut out in the House in each and every step. The Senate's a little different story. They have better tools in the Senate to have minority views heard. The amendment process is much more open. It's not completely on a party line vote. So I think if the will of the people, which is not having the government take over health care, I think there's more likely that what's passed out of the Senate will not have the public option in it. But I think what's coming out of the House probably will have the public option in it.
Well, let me ask you, did you have any town hall meetings during the August recess? Because the pushback there seemed so strong, and it seemed for a time it was a game changer. Do you think that any momentum is left over from those town halls and will carry through to whatever the final product ends up being if something does pass and get to the White House?
Well, the town halls were very powerful messages from the American people in opposition to a public option, the government taking over health care. And I had another health care town hall meeting yesterday. Public sentiment is still the same. Now, it hasn't been so much in the news because of other events with what's going on in the UN with Iran, but public sentiment has not changed. And if the Democrats in the House and in the Senate think that the American public wants to have the government take over health care, then I think it will be at their own peril. They do want to keep their health care, but there is a lot of momentum inside the administration and in the House of Representatives. And I think with the tools the Senate have, Majority Leader Reid could use budget reconciliation and have only a simple majority, not having a cloture vote to overcome a filibuster, but a simple majority push through a public option. But I think if that's the case, there will be significant pushback in 2010 during the next elections.